CRPS is a condition affecting the nerves, making them feel like they're on fire. Ouch! It's the most painful of the chronic pain diseases and is considered incurable, but is it? Lefty had CRPS before I chopped him off. Then my right leg decided to follow suit. If you've seen videos about my CRPS journey, then you know there's an effective treatment in Italy. But what is it? Why isn't it approved in the US? How did I get some, and did it work? Let's get some answers. Bisphosphonates are a group of drugs used to treat osteoporosis and bone cancer. Within that family are different varieties. The one used in Italy to treat CRPS is neradronate. There have been many studies showing that bisphosphonates have a positive effect on CRPS. I'm still not clear on whether it's a cure or whether bisphosphonates put CRPS into remission, but it is clearly proven that they work. Before being publicly available, drugs need government approval to be used for specific uses. Bisphosphonates aren't there yet for CRPS treatment in America. Some countries have more red tape than others. Hence, for the past decade, CRPS patients have traveled to Italy to get help. If bisphosphonates aren't approved in the US, then how did I get some? Enter the best doctor ever. I'd already lost one CRPS-affected limb. When CRPS took hold in my remaining foot, spreading nearly to my knee and pushing through all the treatment we threw at it, he suggested I go to Italy. When I looked into it and told him that it cost tens of thousands of dollars, not covered by insurance, he started thinking outside the box. American doctors can't legally treat CRPS with bisphosphonates because they lack FDA approval, but they can conduct studies.
Research very good.
After researching the drug itself, my doctor had to work with lawyers to address liability issues, make sure the study was set up legally, generate waivers, etc. There was a lot of effort on his part to get set up. For some conditions, bisphosphonates are given as a pill, but for CRPS, it's given via infusion. Rephrased, a liquid medication was mixed into an IV and pumped into my vein over a 5-hour period. Infusions aren't a normal part of my doctor's practice, so he reached out to local providers, but none of them wanted to administer an experimental drug because of liability. So my doctor sent one of his nurses to get certified in infusions. The day after she got certified, we were in business. I was given paradronate via IV infusion. Why not neradronate like they use in Italy? Because paradronate is what my doctor could acquire. The two bisphosphonate varieties are related closely enough that my doctor was optimistic that the paradronate would work. Since bisphosphonates leach calcium and vitamin D from the patient's body, I had frequent labs before and during treatment to monitor my blood levels. I went to my primary care provider and also had to get my dentist's approval. At every appointment, I was given a pregnancy test. I was also asked to sign a paper saying I'd use at least 2 forms of pregnancy prevention for at least 12 months after treatment. In Italy, they give 1 infusion per day for 4 days. Keep in mind, many of their patients travel from other countries, so it makes sense to get the treatment done quickly. My local doctor didn't have to work around that, so he gave me the first infusion, then waited a couple weeks to see how my body responded. After that, we did 1 infusion per week. After my 4th infusion, I was scheduled for a follow-up a month later. If I still had symptoms, I'd be given 1 more infusion. The info sheet I was given said I'd get flu-like symptoms, including a fever, body aches, and nausea. I went in the morning for infusions. By evening, I was experiencing all the common side effects, only they were more intense than I expected, particularly the muscle aches. Of the 3 patients my doctor gave bisphosphonates to, he said I had the worst side effects. This is probably because of other muscular issues I'm experiencing throughout my body, but I'll save that topic for a different day. With each infusion, the side effects were a bit miserable and lasted a few days, kind of like a nasty flu, but that's a small price to pay for saving a limb. Did it work? Yes, it worked, and I'm not the only one. One of the other patients is a friend of mine, and she also has a YouTube channel talking about amputation and CRPS. I'll link her bisphosphonate video in the description. Before the infusions, the CRPS was so painful that I avoided stepping on my foot at all costs. Instead of taking the car to local appointments, I took the sidewalk because the pain of transferring out of my wheelchair wasn't worth the convenience of driving. If I wanted to heat up some lunch, I'd wait a few hours for my husband to get off work. because standing up to reach the microwave hurt too much. By contrast, I'm now learning to walk again. I started seeing changes immediately. During the first infusion, I felt an odd sensation in my foot. Within a couple hours, my foot had changed to a normal color and temperature. Over the coming weeks, the pain decreased and my skin, color, texture, and temperature normalized. Best of all, the burning sensation went away. Turns out I had some lingering CRPS in my amputated leg. I hadn't recognized it as such, for reasons I'll explain a different day, but the immediate improvement I experienced post-infusion suggests that I did still have some CRPS on that side. Over the next few weeks, I had an occasional bad day, but the general trend was rapidly improving. I'm walking more and more each day and haven't been experiencing any CRPS symptoms. When I went in for my follow-up, my doctor and I agreed that the treatment had worked and we didn't feel a need for more infusions. I just spoke with my doctor and he's ready to start seeing other CRPS sufferers, but with an important disclaimer. Technically, these infusions are not treatment. They're experimental medication as part of a series of case studies. Here's another important disclaimer. Nothing in this video is medical advice or treatment recommendations. I'm simply relating my experience. Because this is a study with experimental medication, not treatment, my doctor can't advertise these infusions, meaning I can't tell you his name in a video. However, if you have CRPS and want to ask questions about the study, you can message me on Instagram with the understanding that I'm not affiliated with the doctor and I don't give out medical advice. I guess I'm officially on Instagram now, so follow me there if that's your jam. Also be sure to click the bell on YouTube. Without clicking the bell, you may miss updates and new videos. There's some really fun ones coming as I take back my life. In the meantime, a very special thank you to a very special doctor. And whatever you're going through, hang in there and have hope.